morning. I'm Dr. Kavachitra. Today's class will be on prenatal growth of maxilla. So the contents that we're going to be covering in today's topic are introduction, anatomy of maxilla, articulations of maxilla, the age changes in maxilla, its prenatal growth, anomalies and clinical implications, and the clinical significance. So what does growth mean? Growth is actually nothing but the increase in the size or the number of cells, which was given by Prophet. Development, on the other hand, means a naturally occurring unidirectional change, which is irreversible in the life of an individual from its existence as a single cell to its elaboration as a multifunctional unit until death. This was given by Moyers. So growth and development of an individual can be divided into two stages, which is nothing but prenatal and postnatal. Prenatal is nothing but the one that is occurring when the fetus is in the mother's womb. Postnatal is after the child is born. So anatomy of maxilla. You must have all read it in the anatomy class during your first year. The maxilla is actually the second largest bone in the face. It forms three main boundaries. Each maxilla has 5 parts, which is nothing but the body and 4 processes. So the 4 processes are frontal process, which is an extension of the maxilla projecting upward, medially and backward for articulation with the frontal bone. The zygomatic process, which is nothing but the malar process of the maxilla. It has a lateral extension for articulation with the zygomatic bone. The next is the alveolar process, which is a crested process of the upper or the lower jaw, which houses the teeth. And the last is the palatine process. So then let's go on to the main part of the maxilla, which is the body. The body of the maxilla is actually pyramidal in shape, and it has 4 surfaces: the anterior surface, the posterior or infratemporal surface, the superior or orbital surface, and the nasal or medial surface. So the 2 maxilla actually articulate in the midline at the intermaxillary suture. Okay, so superiorly it articulates with 3 bones: the nasal bone, the frontal bone, and the lacrimal bone. Medially, it articulates with 5 bones, which is the ethmoid bone, inferior nasal concha, and vomer, palatine bone, and the zygomatic bone. Laterally, it articulates with 1 bone, which is the zygomatic bone. Okay, so medially, the 5 bones are ethmoid, inferior nasal concha, vomer, palatine bone, and the opposite maxilla. So moving on to the next surface, which is the anterior surface. It has the nasal notch, the infraorbital margin, the infraorbital foramen, which through which the infraorbital nerve and the vessels pass through, and the canine fossa. The canine fossa is nothing but a depression just present above the root of the canine. So this anterior surface is actually directed forward and lateral. The lower part has the roots of the teeth, the incisor and the canine fossa. And the next is the superior or the orbital surface, which houses the eyeball of the person. Okay, so it is nothing but it actually extends medially and connects with the frontal process. So laterally it attaches to the zygomatic process, and there's an infraorbital foramen. The next is the nasal or the medial process. The nasal surface of the body of the maxilla actually forms a part of the lateral wall of the nose. Okay, and it features a large defect or opening called the maxillary hiatus, which is nothing but the opening of the maxillary sinus. So it also has the lacrimal groove, the nasolacrimal canal and the nasolacrimal duct. The next is the posterior or the infratemporal surface, which actually features the maxillary tuberosity. Okay, so it is actually directed backward and laterally, and it also has alveolar canals that transmit the posterior superior alveolar nerves, which is the branch of the maxillary nerve, and the posterior superior alveolar arteries and veins to the upper teeth. So how does the maxilla age? At birth, if you see, the anteroposterior dimension and the sagittal, that is the transverse dimension, are greater than the vertical dimension. Okay, this is because the teeth sockets, they almost reach the floor of the orbit, and the maxillary sinus is actually present as a small furrow on the lateral wall of the nose. So in adults, if you see, the vertical dimension increases owing to the development of the alveolar process, and there's an increase in the size of the sinus, maxillary sinus. So in old age, if you see, it again reverts back to the infantile condition where there is greater anteroposterior dimension and transverse dimension than the vertical dimension, because the teeth fall off and the vertical dimension of the patient reduces. So moving on to the main topic, which is the prenatal growth of the maxilla. Any cell by itself has three successive phases, which is the period of ovum, the first 2 weeks, the period of embryo, which is 2 to 8 weeks, and the period of the fetus, which is the 8th week until birth. So at an early stage in development, the embryo proper actually acquires the form of a 3-layered disc, which is the endoderm, mesoderm, and ectoderm. So all the tissues of the body are derived from one or more of these layers. So what are neural crest cells? They are a group of ectomesenchymal cells which actually give rise to any kind of tissue. They can be a cartilage, they can be a bone, they can be a muscle. Okay, so the neural plate actually develops an invagination, which is nothing but a depression, and then it forms the neural tube and canal. So surrounded by which are the neural crest cells. And around the 4th week of intrauterine life, the lateral plate of the mesoderm of the ventral foregut actually forms 5 bilateral mesenchymal swellings, which are nothing but the pharyngeal or the branchial arches. So there are actually 6 branchial arches, out of which the 5th one disappears. Okay, so there's a prominent bulge that appears on the ventral aspect of the embryo, which corresponds to the developing brain. And then below the bulge, you find a shallow depression, which corresponds to the stomatodium, which is nothing but the future mouth. The neck is then formed by elongation of the region between stomatodium and pericardium. So each of these arches actually give rise to several parts, like the mandibular arch gives rise to the maxilla, which is the first arch. Okay, so there's an invagination from the pharyngeal arch, which forms the pharyngeal pouch. Then we move on to the development of the face, where the face has 5 prominences that surrounds the central portion, which is the stomatodium, which constitutes the future mouth, as I mentioned before. So 5 prominences are 1 frontonasal process, 2 maxillary and 2 mandibular prominences. Okay, so these are the nasal pits. This is the eye region, and these are the maxillary processes, and this is the mandibular process. So next we move on to the development of the palate. The palate actually is formed by it is formed by the palatine process and the maxillary process and the frontonasal process. Okay, so what happens is there are two parts of the palate, which is the primary palate and the secondary palate. So initially, the palatine shelves actually approximate at the center. They start approaching close by, and then they meet at the central region, and later the anterior and the posterior region fuse. This happens by actually the 7th week of intrauterine life. Initially, the tongue is present on the roof of the mouth. So the palatine shelves cannot approximate. That is why they grow vertically downwards. Once the tongue lowers, there's the lowering of the tongue to the floor of the mouth, the palatine shelves then grow horizontally and fuse to each other. So by the 12th week, the fusion of the palatal processes is complete. So can you just repeat? The palate is formed by the contribution of maxillary process, palatal shelves, and frontonasal process. So how does the maxilla ossify? Ossification actually occurs by a process called intramembranous bone formation. Okay, so intramembranous means compact and bony, spongy bone formation. So they develop intramembranous ossification centers at numerous sites. So how does the palate ossify? The palate actually ossifies by the 8th week post-conception from the spread of bone into the mesenchyme of the fused lateral palatal shelves and from trabeculae appearing in the primary palate as premaxillary center, all derived from the single primary ossification centers of the maxilla. The posterior part does not ossify, and that is why it is the soft palate. And the mid-palatal suture ossifies by the age of 12 to 14 years, which is why rapid maxillary expansion has to be done within that age. Then there is the development of the maxillary sinus. So the maxillary sinus is the first air sinus to develop in the head region, and it develops around 4 months of intrauterine life. It develops on the medial side of the maxilla as a small invagination of the nasal mucous membrane in the maxillary bone. So it forms from the middle meatus by a process called pneumatization. Pneumatization is nothing but air being filled in a cavity. So the volume of the region increases. Okay, it extends into the ethmoid cartilage. So then secondary pneumatization occurs into the ossifying maxilla, which starts about 5 months in the sinuses, which is large enough to be radiographically appreciated. Thank you.